Welcome to today's episode of the One USMLE podcast, where we dive deep into the workings of the immune system. Today we have an interesting case that involves a common treatment for venomous bites. Let's get started with a case question. A 25-year-old woman is brought to the emergency department after being bitten by a rattlesnake. She receives multiple doses of horse-derived polyclonal Fab antivenom. 2 weeks later, she presents with fever, joint pain, and a rash. What type of hypersensitivity reaction is most likely occurring in this patient? If you guessed a type 3 hypersensitivity reaction, you are correct, but let's break down what's happening in her immune system and why. Polyclonal Fab antivenom, like the one our patient received, is made from the plasma of animals that have been immunized with venom. These antivenoms are life-saving, but they introduce foreign proteins into the patient's body. Here's what happens step by step. Immune recognition. The foreign proteins in the antivenom act as antigens. Once in the bloodstream, these antigens are taken up by antigen-presenting cells and presented to CD4 plus T lymphocytes. Antibody production, activated T cells, then help B cells recognize these antigens. The B cells transform into plasma cells that produce specific antibodies, primarily IgG, targeting the antivenom proteins. This process typically takes about 1-2 weeks. Formation of immune complexes. The IgG antibodies bind to the antivenom proteins, forming immune complexes. Normally these complexes are cleared by the immune system. Clearance mechanisms. The Fc portions of these antibodies can bind to Fc receptors on phagocytes or activate the classical complement pathway, both of which help clear these complexes. Overwhelmed system and serum sickness. However, when multiple doses of antivenom are given, the number of immune complexes can become too high to be cleared efficiently. They then accumulate and deposit in tissues like the skin and joints, triggering inflammation via the complement system. This results in serum sickness, characterized by fever, rash, and joint pain, exactly what our patient is experiencing. So, in our case, the repeated doses of horse-derived antivenom led to the formation of immune complexes that couldn't be cleared quickly. The deposition of these complexes caused a type 3 hypersensitivity reaction known as serum sickness. Now, I'd love to hear from you. Have you ever encountered a case of serum sickness in your practice or studies? What were the challenges and how was it managed? Share your experiences in the comments or send us a message. We might feature your story in our next episode. That's all for today's episode. Thank you for tuning in, and remember to stay curious and keep learning. Please like, share, subscribe, and visit medmadness.co to buy the full immunology course.